two deputies, Jonathan O'Brien and Deputy Louise O'Reilly. You're sharing your time equally? Yeah, Deputy O'Brien.
I think I'm going to be taking about 25 minutes and Deputy O'Reilly 5 minutes. Minister, I welcome the opportunity to speak on the Misuse of Drugs Amendment Bill 2016, and I followed the progression of the bill through the Seanad, and I have read all of the contributions by senators and yourselves during this passage in that chamber. And my party colleague in the Seanad, Senator Maura Devine, has outlined our support for the bill, and she also put on the record of the Seanad our misgivings in relation to the legislation. Now, I want to outline my own critique of the legislation for the record of this chamber, Minister. Essentially, when enacted, this legislation will have the effect of criminalising any person in possession of the listed prescription drugs when they do not have a legally held prescription. This piece of legislation will criminalise vulnerable drug addicts. It's as simple as that, Minister, and there is no getting away from that fact. Ireland in the 70s, the 80s, the 90s, the noughties, and now in 2016 has viewed drug addiction as a criminal issue rather than a public health crisis, despite government announcements to the contrary. Introducing a criminal penalty for drug use is about as far away from the government's stated intention in the programme for government of moving towards a harm reduction healthcare model of drug treatment that you can possibly get. In basic terms, what this legislation is proposing is the ability of the state to arrest, charge and convict vulnerable addicts for the possession of prescription drugs for personal use. Now, I would be one of the first to sympathise with communities who are living with the scourge of drug use, Minister. Indeed, I have seen firsthand what it can do to families. And I genuinely believe that we should be doing everything within our power to reduce drug abuse. However, this legislation would clearly not achieve that goal. In fact, during a briefing with officials from the department in relation to this bill, it was suggested that this was being brought forward because the Gardaí had requested it in their fight against organised crime. It was also stated that there was no consultation with the drug service providers in this state, nor was there any consultation with the medical practitioners, who are very often responsible themselves for giving out large doses of benzos to individuals with drug addictions. And God forbid we might ask the drug users themselves what their needs are in relation to their addictions. Now, this is not the first piece of legislation that has been brought forward simply because the Guards want it. Legislation that gives the Guards wide-sweeping powers to view electronic communications is planned, and legislation that will increase the penalties for women engaged in sex work is on the schedule already, and all because, from what we are being told, the Guards have stated that they need it. Now, that is no way to formulate justice policy or to develop it, and it is certainly no way that health policy should be developed. And while we must listen to the Gardaí with regard to what powers they may like or need, we as legislators certainly shouldn't be creating legal frameworks based solely on their views. It is not good enough that the government ministers talk about evidence-approached models and then introduce a bill like this. This bill will not address drug use, and it will not address gangland crime, as the Minister for Drugs and the Minister for Justice has attempted to state. The only people affected by this bill are the drug addicts, who are the problem users of unlawfully held prescription drugs, and the drug addicts who sell on their lawfully held prescriptions of benzos to fund a heroin addiction. Now, the Gardaí can currently seize benzos which are currently held by addicts or individuals, if they so want. But what the result of that is, it's not going to magically wipe out any debt that an addict may have to a drug dealer for buying heroin. What's simply going to happen is that the next time that addict is going to increase the amount they take to sell in order to pay off the debts that they previously owed to local drug dealers. And criminal penalties will not have any impact on their addiction, and it won't eradicate the antisocial behaviour of dealing that sometimes goes with it. If criminalising the possession of drugs, prescription or otherwise, had any impact on the rates of addiction, we wouldn't have the highest rate of drug use in the history of the state today. Furthermore, if it had any impact, we wouldn't have young people walking into Mountjoy or Cork prison and then being released with full-blown addictions that they did not have on entry. Now, if the government and if the state as a whole was actually serious about addressing problematic drug use, then they would be looking at investing in communities that are most affected by it. And the Proceeds of Crime Amendment Bill 2016, which has just passed second stage in the Shannon, is going to have a series of amendments put forward by Sinn Féin, which will state that all monies seized by the criminal asset bureaus be ring-fenced and put back into communities worst affected by drugs. Yet today, our Shannon spokesperson who put forward those amendments was contacted by a senior civil servant asking him to withdraw those amendments on grounds which I believe were just false. He said that it was impossible to implement those amendments and asked him to withdraw it. It is in the areas where you have embedded poverty, Minister, generation upon generation of unemployment, poor education standards and a lack of facilities where problem drug use flourishes. Policy responses from the state very often give a passing acknowledgement to the environmental and social background of the drug problem facing these communities, but seldom actually address the need to actually do something about the wider social and economic issues that feed drug addiction. Instead, the state pays lip service to the provision of detox facilities and rehabilitation and pays no regard to the astonishing levels of social deprivation. And if you ever wanted evidence of that, Minister, in the whole 26 counties, there are 4 beds for adolescents to detox in this state. 4 beds in the whole state for detoxing adolescents. Now, we have methadone maintenance programs, we have limited needle exchange programs, and we have some excellent locally based services who do great work in spite of the HSE funding structures rather than because of them. Now, far more needs to be done, and there needs to be an explicit commitment to a harm reduction, health-led approach that is actually matched by the policy and the resources to go with it, not this reactionary nonsense. What we need to do is move towards a model of decriminalisation for personal use, along the lines of the Portuguese or the Swedish model or even the Australian model, and as agreed by the All-Party Justice Committee when they looked at this issue. An evidence-based model based on international best practice. Now, during the committee stage of the bill in the Shannon, Minister, you yourself said that that was your goal, and that is what you were going to do in relation to future drug policy. Have an evidence-based approach based on international best practice. I just find it ironic that in this instance we are ignoring all of the evidence and the international best practice by further criminalising drug addiction. This legislation, as it is currently drafted, is pure rhetoric, in my opinion. It is about being able to say that this government is doing something about organised crime, regardless of whether it works or not. And if members of this House think for 1 second that it's going to have a lasting impact on organised crime, then they are sorely mistaken, in my opinion. This will not result in any increase of tolerance or respectfulness towards drug users. Like those in our prisons, many consider them not to be worthy. They are seen as a social problem to be dealt with on the part of the state rather than individuals who may need medical treatment for the affliction of addiction. And there will be little difference in the rates of drug use in the years to come, Minister, unless we tackle the core issues, such as poverty and deprivation. And without addressing that, we were going nowhere. Now, that does not mean simply giving more resources to the Gardaí to combat drug dealers and traffickers and the addicts criminalised by this legislation, albeit important to do that, Minister. But we must also address the housing and the educational issues that are the basis of social exclusion. The approach to drug policy in this state has always been marked by words that are undermined by actions. The government established the local drug task force in 1997 to address the dual concentrations of problems of drug use, poverty and social exclusion. And many of them have done great work. I sat in one myself in my own local area. And they've done great work to reduce the drug-related harm to individuals, families and communities by working in partnership with the community and with the voluntary sector and with the health services. However, the impact of austerity policies, Minister, on whole communities and the reduction of funding to these services is going to have an impact for generations to come. Levels of poverty have increased massively since 2008, where already deprived social groups are experiencing much higher rates of poverty than others. Over half of those who live in social housing are unemployed, and of those who live in one-parent families, over half experience deprivation, with over one-third of those being designated at risk of poverty, living on less than 60% of the average income, amounting to less than €200 per week. It is not surprising, Minister, that some people self-medicate the trauma of growing up in poverty with drugs when they are surrounded by communities in decay simply because governments want to line the pockets of the haves rather than the have-nots. And over the past 2 decades, drug production, supply and consumption has changed, and the types of drugs people are taking depends on what is easily accessible and how much it costs. And according to the HSE's own figures, the number of people accessing methadone has increased every year for the past 5 years. Now, some may say this is a good thing, but we don't actually know if there's a definitive corresponding reduction on the numbers of people taking heroin. And in many, many cases, you have people taking both methadone and heroin. And for over a decade, there have been people who would be described as benzo users. And it now seems that the state is only waking up to that and catching up with it. We see young people commonly taking cannabis, cocaine and pills along with alcohol. There are the new psychoactive substances that are coming out all of the time. And for every drug the government has managed to put on a controlled substance list, new ones have appeared. Gone are the days when a person who was an addict simply stuck to one drug. Polydrug use is a major issue now, with persons taking cannabis and benzos and alcohol. And this legislation isn't going to address polydrug use. And as far as those who are working on the ground in drug task force are concerned, as well as those who are active drug users, there is no shortage of drugs despite the recession. And in actual fact, drug use has massively increased during the years the government inflicted austerity policies on communities. Now, if the people who design these ill-thought-out laws were to engage with people who were in the throes of addiction, they would find that the years of austerity have had a major impact on them. Welfare programmes have been restructured and made harder to access, and despite what the Labour Party used to bang on about in terms of no changes to core payments, there has in fact been reductions in social welfare payments. There is a lack of respite and detox places for those who wish to exit addiction. And despite an acknowledgement in this legislation that benzodiazepine use is a major social problem, there is a severe lack of treatment options for those who wish to exit the use of benzos. And further to this, the HSE drug treatment services have in many cases been rightly criticised for its lack of engagement and consultation with the community and voluntary services who are actually supporting them. While there is no work for people in certain areas over the years, as unemployment rates soared and social deprivation took grip, there was a corresponding expansion of the drug economy that destabilised these communities even further. That is no coincidence, Minister. It is no coincidence whatsoever. Now, no one for 1 second would defend the so-called drug traffickers and organised crime figures. Nobody would defend them, and they need to come under the full rigours of the law for their activities, because they are the people who are destroying communities as well as those who have addictions. But I have to say it is very, very hard not to have some sympathy for a young lad who ends up in the drug economy, having grown up in a community where it has been prevalent for many, many years, and where there has been very little economic opportunity for him or her outside of that community. Now, I'm not making excuses for those individuals, Minister, but I am just saying these are factors why young men and women end up in the drug economy as users, and obviously as addicts then having to sell to fund their addiction. Now, the outcomes of government policies have been negative and consistently moving towards the idea that if you simply address the addiction of an individual, that somehow the context in which the addiction manifested itself in the first place will miraculously resolve itself. And we are in a space now with this bill where there is no cognizance taken of the outcomes of government policy and no mind paid to the fact that individuals aren't always singularly responsible for their problematic drug use. If that were the case, then simply telling children in schools to just say no would be a perfectly valid response to drug problems, and we all know that that's not the case, Minister. The approach taken to drug use in this jurisdiction is one that is based on a public system that measures outputs, effectiveness and value for money. There is no assessment of the needs of people and communities. It is based on listening to consultants telling government departments how they can run things on a skeleton crew with less money but to do more. And it doesn't matter if more might not work. And recently I spoke to somebody from the department, in fact, in relation to the supervised injection centres, and while I certainly welcome that, Minister, it's going to be a very progressive initiative, I do have some concerns that we're only looking at a pilot project initially, and we're not looking beyond that, which is the consumption room models. Now, that is another debate, and that's one we can have further down. But in preparation for this legislation, I asked a number of PQs to the HSE regarding levels of drug use. In 2014, there were 725 cases of under 18s being treated for problematic drug use according to HSE records. Yet, as I said, there was only 4 detox beds. 725 cases, but only 4 detox beds. Those 725 cases are the ones that are either looking for, waiting for, or in the middle of a drug treatment programme. There are only 2 service providers in the whole of the state reported as providing needle exchange services for individuals under 18. 2 in the whole of the state. We have no idea how many other individuals under 18 are out there and who are not in treatment or who haven't come seeking treatment yet. There are 10,165 methadone users registered here, and that's increasing at the rate of about 100 each year. The number of people who have entered drug treatment for specifically drug problems as opposed to alcohol use has risen from 7,363 in 2012 to 9,046 in 2014. Clearly, policies that criminalise addicts is not working. The figures bear that out. And all the stats indicate an increase in the problem. One of the analyses being put forward by the proposers of this bill, such as yourself, Minister, and the Gardaí, is that the Gardaí don't want legislation to go after vulnerable addicts or someone who has an addiction that may have prescription drugs on their person for personal use. And I don't believe that that will be the case. And I only have to look at the crime figures from recent years to know that that will not be the case. In the 10 years between 2004 and 2014, there was approximately 187,000 people charged with drug offences in this state. Around 90% of them, 90%, Minister, almost 160 individuals were prosecuted for the possession of small amounts of drugs for personal use, resulting in a criminal conviction. Now, clearly this policy of criminalisation is going to continue with this bill. Now, leaving aside the consequences of having a minor drug conviction for possession for one moment, how can anyone suggest that this is a necessary or valid use of public money? 168,000 people convicted for having drugs for personal use. Now, getting back to the personal consequences of having a criminal conviction for the possession of drugs for personal use, I want to make a few points in conclusion. In many local authorities, there is now a policy of doing Garda checks on prospective tenants. And while I don't object to this in principle, there is growing evidence that individuals with minor drug convictions are being discriminated against in housing allocation. Having a minor conviction for drug possession for personal use has lifelong implications, and I simply do not believe that we should punish addicts indefinitely, even if they are no longer involved in drugs. And can I also say that simply excluding former addicts with a criminal conviction from the housing process and introducing further legislation which is going to criminalise individuals isn't going to address the poverty of these people or their addictions, or in fact the issue of antisocial behaviour that goes with drug use. Those with addictions are victims of neoliberal austerity policies implemented by this government and previous ones. And I cannot see the practical benefits of supporting such a legal framework that not only will not address the issue of organised crime as it is alleged it will do, but will also target addicts, actively making the lives of some of them worse. Now, Minister, I'll finish on this. In your Shannon contribution, and I read, as I said, all of it, you stated that this legislation, it is the innocent victims who are most affected. Completely agree. You went on to say, it is not the people who have the fancy cars, the fancy houses, and who do not live in this country. They are the people that this legislation is all about. Now, Minister, I find that a very, very bizarre statement when you take it in the context of the government's allegation that this is going to address organised crime, while simultaneously backing up your public health approach to drugs. You can't have it both ways, Minister. Further punitive legislation as a policy response does not work, has never been proven to work, and this bill simply creates scapegoats rather than solutions.
Thank you, Deputy.